Hello, welcome to our today's presentation. This is Mungare Nicholas from Kenya, representing Team Negative in our Group 4 presentations. Our topic is, should African nations invest in gene therapy as a long-term solution for chronic and genetic diseases? Well, let us begin with the introduction, starting from reality. Slide 1. Across Africa, families still lose children to malaria, mothers to child complications, and at large communities to preventable infectious diseases. Although Africa carries nearly 24% of global diseases burden, it accounts for less than 1% of global health expenditure. In this context, gene therapy represents an exciting scientific breakthrough, but it does not directly address the most urgent and widespread health challenges facing Africa's population today. So you see, we have challenges that are preventable, but still we're not in that position to overcome it, or rather cushion ourselves against these preventable diseases. Slide 2. Constructive arguments about cost versus lives saved. Well, gene therapy is revolutionary but extremely expensive. Some approved treatments cost of more than $2 million per patient. And in our health system with limited budgets, this presents a critical ethical dilemma. Will we really manage? That's the question. The same funds could vaccinate thousands of children, pay salaries for hundreds of healthcare workers, or equip multiple hospitals with essential medical supplies and other equipment that are needed. Public health policy must prioritize interventions that save the greatest number of lives with available resources. Let us use the available resources and maximize them in a better way to cover a larger population. Another slide. Infrastructure comes first. Gene therapy requires advanced laboratories, ultra cold storage facilities, reliable electricity, and a high specialized personnel. However, many African healthcare facilities struggle with basic infrastructure, including frequent power outages, inadequate laboratory capacity, and staff shortages. I'm so sure that these are things that we familiarize on the ground in Africa. Introducing advanced genetic therapies into systems that cannot consistently support routine medical services, it even brings more risk and inefficiency, inequity, and failure. Another slide about safety and regulatory challenges. We see gene therapy remains a relatively new medical field with limited long-term safety data. Most clinical trials have been conducted outside African populations, raising concerns about applicability and genetic diversity. In addition, regulatory systems in many African countries are still developing, making it difficult to ensure safe oversight. Premature large-scale investment could expose patients to unnecessary medical and ethical risks. Another slide, equity and fairness. You see, healthcare innovation should reduce inequality, not deepen it. We need to reduce the inequality that already exists. Currently, gene therapy benefits a very small and wealthy population. Heavy investment in such high-cost interventions risk widening existing health disparities, while millions still lack access to basic healthcare services like malaria, for instance. African health priorities must remain inclusive, equitable, and focused on population wide impact. Another slide as I present my rebuttal part against my team. Access asymmetry argument. We see inequality in access does not automatically justify gene therapy investment. Africa's urgent needs remain 1. Primary healthcare, 2. Prevention and early diagnosis, 3. Essential medicines. Gene therapy benefits only few patients. Resources should prioritize maximum population health impact. Another slide on readiness through initiatives. My argument is genomic initiatives is not equal to gene therapy delivery capacity. Gene therapy requires 1. Advanced manufacturing facilities, 2. Specialized clinical expertise, and number 3, long-term monitoring systems, which we don't have. Most African health systems lack these at scale, and also current initiatives indicate progress, not readiness. We are not ready for the gene therapy process. Another slide, genetic diversity advantage. We see high genetic diversity increases research complexity, regulatory challenges, and development costs. At the same time, therapies require extensive local validation. We need to validate our data here in Africa. The risk of genetic data exploitation without strong safeguards, it exposes us to that risks. And also, diversity is valuable but not an immediate operational advantage. Next slide. Existing success stories argument. Okay, current successes are pilot based, highly controlled, limited in scale. That is what it is. We see that pilot success is not equal to system wide readiness. Continent-wide adoption requires harmonized regulation, trained workforce, sustainable financing, and these conditions remain inconsistent in our continent, Africa. Another slide about financing, cost and financing. We see gene therapy costs remain extremely high. European financing models depend on universal health coverage, strong insurance system, stable tax bases, which when we compare to our African continent, we're not ready for that. We still face challenges like corruption and what have you. But at the same time, most African countries lack these structures. Cost remains a major structural barrier in Africa. As I move to the next slide, my closing statement, or rather closing remarks, gene therapy is a future opportunity for Africa, but not a present priority given existing health system realities. I also have another slide about reference where I reference my research from World Health Organization, Global Health Estimates, World Bank, Health System Strengthening Reports, the Lancet. We also have Global Health Nature